topic for my presentation is modalities in physical therapy. For my introduction, I have 3 questions. What are modalities? Modalities are a variety of treatment tools used by physical therapists to decrease pain, inflammation, and muscle strains. The second question is, when are modalities used in physical therapy? And modalities in physical therapy are used pre-surgery, post-surgery, and throughout the rehabilitation process. And the last question is, what is the future for modalities? And since modalities are fairly new to physical therapy, the more they're being used, I believe that the future is great and it could have a huge impact in the field of physical therapy. My thesis is, contrary to what many believe, the use of modalities in physical therapy is crucial for the rehabilitation of an injury and can also speed up the recovery. What are modalities? According to PureWebMD, when talking about modalities, it states that many of the treatments are for pain reduction and some for the specific goal of healing. And when dealing with modalities, there are 5 types: ultrasound, electrical stim, hot therapy, cold therapy, or cryotherapy, and massage therapy. Ultrasound therapy has been used for numerous of years as a therapeutic agent and is defined as a mechanical vibration transmitted above the frequency for human hearing, causing the molecules of the media through which is transmitted to oscillate. Electrical stim is applied in a very controlled way and is often used to initiate muscle contractions to gain muscle strength. It can also be used for muscle reduction or re-education, which helps increase the control of your muscle after surgery. The next one is massage therapy. Massage therapy is relatively new to physical therapy and can be defined as the use of the hands to physically manipulate the body's soft tissues for the purpose of effecting a desirable change in the individual. And this therapy is basically used to relieve pain and is used for deep tissue and muscle problems. Hot therapy is similar to cold therapy in terms of application, but it's superficial heat. It decreases the nervous system activity, and it helps to reduce muscle spasms, which relaxes the muscle. And then the last type of therapy is cryotherapy or cold therapy, and it's the principal effect of cooling. Helps reducing the metabolic rate, which lowers activity in all the tissues, and it also reduces the oxygen uptake. It typically varies from using gel packs, ice packs, or just massaging with ice. And cold therapy is either being used to reduce pain or to reduce swelling. When do patients use modalities? Dr. Patterson researches the use of modalities, and he states that modalities can be used to help with chronic and acute injuries. He also believes that therapeutic exercise will improve strength, increase range of motion, and functional compactly, and it also improves cardiovascular fitness. Each patient requires different types of modalities. Not every injury requires the same modality. It depends on the patient. And then wise decision making. Since the physical therapist is in charge of deciding which modality to use and which rehab to use for each patient, it is crucial that he or she has a good understanding on the patient's pain tolerance and the patient's injury. each patient has a different pain tolerance. And then, for example, for a total knee replacement, one shouldn't use heat because initially because you're trying to reduce swelling and pain to begin strength training and getting the patient back to where he or she needs to be. So heat would do the opposite and inflammate the muscle instead of help. And from our conclusion, opposed to what many people believe, the use of modalities in physical therapy is indeed essential for the rehabilitation process. Modalities can also speed up the recovery time for a patient